Hi, I'm Michelle Grzoulis, and I'm president of the foundations at Rochester Regional Health. And I'm joined today by Dr. Laurie Lerner, who is a pulmonologist at Rochester Regional Health. Dr. Lerner, thanks for joining me today.
Thanks for having me.
We're here to talk about lung cancer and lung health, as November is Lung Cancer Awareness Month. As always, I invite people listening and watching to ask questions in the comments section, and we'll pause periodically to make sure we get your questions answered. So, lung cancer is a leading cause of cancer deaths worldwide. Is it fair to say, Laurie, that tobacco usage is the reason for it?
Yeah, there's several risk factors for lung cancer, but by far tobacco is the biggest risk factor. We often say that smoking accounts for probably 9 out of 10 lung cancers in men and 8 out of 10 in women.
Wow. Say those statistics again.
9 out of 10 cancers in men and 8 out of 10 lung cancers in women can be attributed to smoking.
Wow.
Mm-hmm.
I mean, I knew it was high, and I knew that the correlation was there, but those are pretty significant numbers.
Mm-hmm.
Can non-smokers get lung cancer?
They can. You know, there's additional risk factors, and sometimes we don't know why someone gets lung cancer, but risk factors include family history of lung cancer, as well as family history or occupational exposures, and also age. So, and secondhand smoke as well is a risk factor. We often say about 25% of lung cancers in non-smokers are due to secondhand smoke.
So 25% of cancers in non-smokers is due to secondhand smoke.
Mm-hmm.
Wow.
Yeah.
I mean, I don't know I forgot how long ago the laws I think that, I don't know, in New York changed to prevent smoking in public places, but that must have been a huge help in reducing the incidence of that.
It is, you know, and we have data that says if you live with a smoker, your chances of developing lung disease or lung cancer go up by about 2/3.
And just really quickly, I know it's not what we had talked about, but just very quickly distinguish what's the difference between lung disease and lung cancer. So what's a lung disease as an example?
Right. So lung disease spans a whole gamut of different problems in the lungs, but smoking-related lung disease is typically what we call COPD. Mm-hmm. And that's broken down between emphysema, which is kind of a breakdown of the lung spaces where people have trouble, you know, getting the oxygen in and the CO2 back out. And then this idea of chronic bronchitis, that's the smoker's cough, daily productive cough. Yeah. And those two, you know, categories make up this bigger category of COPD.
Okay, let's talk about cancer. So what exactly is lung cancer?
So lung cancer is a malignancy. So there's cells that make up the lungs, and one of those cell types becomes malignant, and meaning they're able to reproduce without control. That's a malignancy. So the main types of lung cancer are either what we call adenocarcinoma or a squamous cell. There's also another group called small cell carcinoma. So kind of these two major groups of non-small cell and small cell.
Is one, this is a terrible way to say it, but is one better than the other to have in terms of mortality or cure rates?
Neither are great.
Okay.
So non-small cell lung cancer is kind of the classic lung cancer. Like if someone says, you know, they were diagnosed with lung cancer, that's what we're looking at. If you're going to get a lung cancer, you want to find it at an early stage. So when you say, you know, is there a good lung cancer to get? It's an early lung cancer. Yeah.
Early diagnosis. So let's talk for a moment about demographics. What's the primary demographic of people who are most at risk for lung cancer?
Mm-hmm. So since tobacco is the most powerful risk factor, really the more pack years, and when we talk about pack years, that's kind of a term that we use in medicine for how much a person has smoked. So for example, if someone smokes 1 pack per day for 30 years, they have a 30 pack year history of tobacco use. Wow. If someone smokes 2 packs a day for 15 years, they also have a 30 pack year history. So it's a way of quantifying, you know, exposure to the carcinogens. So what we have found for screening is the high risk patients are people who have smoked over 30 pack years. You know, between the ages of 55 and 77, and have quit smoking less than 15 years ago. Because certainly we know quitting smoking is important. And as the time passes from quitting, your risk of cancer is dropping. So the people we choose to screen are those that have the 30 pack years and have quit less than 15 years ago.
Okay. I want to talk about technology in just a second in terms of catching lung cancer, but I want to ask you this question, and it's going to sound like a really simple, non-medical way to ask the question, but is it when people quit smoking? I mean, it's logical, you're not taking in, but is it that your cells actually regenerate, and so the tissue that was affected by the carcinogens is actually just kind of eventually dies off and goes away? Is that sort of how that works biologically?
So lungs don't regrow.
Okay.
So, our lungs typically grow from birth to age about 20, 30, and then from then on out, from 30 to the end of life, we all lose a little bit of lung function. And we're losing it at a set rate. That's normal aging. However, when someone smokes, that drop off is much quicker.
Okay.
So
Makes
if
sense.
you quit smoking, you're not going to regain that lung function, but you're going to go back to that normal rate of loss.
Okay.
So we're not going to regrow lung. Now, as far as the risk of cancer, it's not really clear. It's probably that as you're smoking, there's an additive effect on the cells as far as mutations, and that you just don't have that additional mutation that causes the cells to shift over into malignancy.
Okay. That's helpful. Thank you. Yeah. So what technologies are we using or are used in the broader community to catch lung cancer earlier? Because if it's early detection is the best way, how do we do that?
So lung cancer is notorious for being able to hide in the lungs. And the reason is we don't have nerve endings. We don't feel pain in the lungs. The equivalent is like cough, right? So as a result, lung cancer can grow silently for years before someone develops symptoms. And that's why historically lung cancer has been the leading cause of death of cancers, is because it hides and we don't find it. So, historically we had chest x-rays and we had CT scans, but the CT scans required quite a bit of radiation historically. So everyone was very uncomfortable about using this CT scan technology for screening. And in the last maybe 10 years or so, there's been huge advances in the technology of CT scans, in that the dose of radiation that's used is quite small.
Okay.
And so now they're able to get very good pictures of the lungs in the CT scan with what we call a low dose CT scan. Takes very fine little cuts, but not quite as detailed as a CT scan that is a diagnostic CT scan. But the radiation exposure is really only about 1.5 times what background would be for a year. So we feel comfortable having people exposed to that level of radiation. So now we can take a detailed picture of the lung with a CT scan once a year. So small little spots that might have gone undetected for years, now we can find those spots
earlier. Okay. I want to talk a little bit more about that in just a minute, but I want to pause and make sure that the listening audience knows to ask any questions that you might have. So, Phil, any questions that have come in?
Just advice, general advice to people who want to quit smoking.
So quitting smoking is going to be the single best thing that you could possibly do for your health. And what I tell my patients when they're trying to quit smoking is it just takes multiple tries. And the good news, though, is that the more times a person tries, the more likely they are to be successful in quitting. And that it's part of the process. Yeah. It's a journey of quitting smoking. And each day you wake up and it's a new day of trying. Yeah. We're here in the pulmonary department to support people, to be the cheerleaders for smoking cessation, and also to understand the struggles of doing it.
And I know we have a smoking cessation program.
Yes.
So what's the best way for people who are watching to get connected to that?
Right. So within the Rochester Regional, if you call the pulmonary department at 922-4409, we have access to referrals to the smoking cessation. New York State has New York State Quits. And then there's also national resources, but New York State Quits within New York State is the best resource.
And you said 922-4409?
Correct.
Okay. And that's to get connected to our pulmonary
office, and then they can steer people.
Okay, so let's go back to, you were talking about the technology to screen, so the images of our lungs. Can lung cancer be prevented?
Yeah, it can. There's a certain amount, there's risk factors. And, as we said before, smoking is the #1 risk and by far the most significant risk factor for cancer. So smoking cessation is really the cornerstone of preventing lung cancer. We do have some good news. If someone quits smoking by the age of 40 or 45, if they've been a smoker, a pack a day since the 20s or so, they can reduce their risk of having lung disease or lung cancer by 2/3
Wow.
after about 5 or 10 years
It's amazing.
of having quit. Yeah. And in general, it's never too late to quit. Yeah. We have a ton of data that says if you quit in your 40s, you're going to drop your lung cancer risk almost to normal. And your risk of lung disease significantly, probably by 90% if you quit by the time you're 40. But even those people who quit in the 60s and 70s still have a huge reduction in risk. And in fact, there's data that if someone quits tobacco on the day they receive a diagnosis of cancer, hopefully people are not going to be getting a diagnosis of cancer, but if that's the case, their chance of dying from that cancer is dropped by 2/3.
Wow.
They're going to get more intensive therapy, have a better response to therapy, and the chance of the tumor recurring is going to be less.
Wow.
So it is so clear it's never
Too late to quit.
Mhm.
And I have to say this, even though we're talking about lung cancer
Yeah.
and it's Lung Cancer Awareness Month, but I mean, there are so many other reasons to quit smoking as well when you think about the increased risk of stroke and so many other issues that just are harder for us to survive. So let's talk about symptoms, because one thing we always try to do is educate people on when is it's natural as you listen to these to say, well, wow, what if I have that? So what are the typical symptoms that someone might be having that you would say, hey, I think it'd be great to get in and see a pulmonologist?
In terms of lung cancer?
Yeah.
Yeah. Well, lung cancer hides, so it can remain asymptomatic for a long time. It's why we're really pushing screening.
Okay.
So screening should happen when someone's asymptomatic.
But who should be screened? Like, who's a candidate for screening?
So people who have smoked 30 pack years,
Okay.
over the age of 55.
Okay, that's where that comes in. Okay.
There's some special cases where if someone has a big family history or lots of occupational exposures, we'll kind of try to get them into the screening program. But right now, those pack years, 30 pack years, over the age of 55, have quit less than 15 years ago.
Yep. And potentially environmental exposure. You said something, and I want to ask about this too. Is there, some of the cancers out there have a very high hereditary risk. Is lung cancer one of those as well?
It does have family history risk, but it's not quite as powerful. And we don't have specific genetic markers that we know about or test for.
Okay. So, but let's say so screening is the best way, but what are...
If there is a cancer, gosh. So when a cancer does become symptomatic, the main way that presents is either with cough. Sometimes people will cough up blood.
Okay.
Weight loss. Weight loss is a huge one. And also increasing shortness of breath.
Okay. So you talked about our smoking cessation. Oh, let me actually follow up. I want to make sure I close this out. So if someone has those symptoms, first thing is to talk to their primary care physician and then see a pulmonologist.
Correct.
Okay. And the diagnosis of that is done through the pulmonologist and the radiologist. Okay.
Yeah, so it's a multidisciplinary approach, but probably starting at pulmonary.
Okay. So you talked a little bit about our smoking cessation program. There's another really great program that we have that I want you to take a moment to talk about, and that's our lung cancer screening program. So share with the listeners what we're doing there, because I think that's incredibly powerful.
Right. So, typically screening, like mammography, is kind of an independent, once a year, you get a prescription and go in for your test. But lung cancer screening is a little different, so the benefits of lung cancer screening are really seen if someone's going year after year.
Okay.
Not just, once here and once there. And what we find is that when we do a CT scan, we know ahead of time there's going to be lots of extra findings. So the lungs have nodules, and I often tell my patients nodules are kind of like freckles of the lungs, right? So if I did a CT scan on 100 random people off the street, probably 40 or 50 would have some sort of nodule, right? And about 95% of those nodules are stone cold normal, just normal, a freckle of the lung, right? So the trick for us is to tell which one of those little freckles is a malignancy hidden in the sea of these benign nodules, because an early lung cancer is going to look just like all these other freckles. And the lung, you can't just go and biopsy it, right? So the skin is easy. We can do a little biopsy. We can tell if that freckle is malignant. So the lungs takes a more comprehensive approach. So we find we have this sea of nodules, and we have to sort out which one of these do we care about.
Yeah.
So we end up doing a lot of monitoring of the nodules. And it takes really a more comprehensive team approach to kind of keep people on our radar when
Yeah.
we're watching the nodules and make sure the CT scans are done on a timely basis. And also to kind of take a team approach with the radiologist where we sit down and go, okay, we've looked at this nodule before. Here it was 6 months ago. Here it is now. Is it the same in every little angle?
Should we be concerned?
When do we get worried? So we've set up a program at Rochester Regional to really house this whole process of
fantastic.
tracking the nodules, because there's so many man hours involved in really kind of trying to track these and make sure people get to the right places, get their scans on time. The nodules are looked at by a multidisciplinary group. So we have a great resource. In fact, we're the only comprehensive lung cancer screening program in Western New York that's doing this, and we're, I'm forever grateful to our organization, for letting us have this program. But I think that we're creating a safety net to make sure that no nodule ever gets lost in
Yeah.
the shuffle.
Yeah.
It's really the mantra that I give my staff, no nodule gets lost.
Yeah, that's really cute.
And but it's also a place where people can feel comfortable, getting their screening. And I think a lot of the reason that lung cancer has been in the shadows is that smoking is the number one risk factor, and people feel, maybe like I caused this.
Yeah, the shame.
A shame. There is a shame piece. And I feel like we need to bring lung cancer out of those shadows
Yeah.
and say, look, it's not the deadly disease it once was. We have a screening that can change lives. In the trials, the mortality reduction was 30% when we screened. And in fact, there was a new trial that just came out in Europe where they screened just a little bit differently, and they had a 60% mortality reduction in the women.
Well, it's really interesting. I, obviously the foundation's goal is to help raise money for the health system, and we recently worked with a fantastic family that made a gift to the health system to provide some additional software for the lung cancer screening
Yes.
program. So I became very educated about the lung cancer screening program, and when you look at the data about the ability to diagnose tumors earlier and the ability for us to catch them. What you said before is important. It's not about not getting it, it's when you get it, let's find it earlier.
Oh, yeah.
And so it's some really powerful data on our lung cancer screening program that I think
It
is a
is.
huge benefit to the community.
Yeah.
And we're lucky to have people who care about it.
Thank you for asking that, because it is. It's such wonderful news. So historically, lung cancer, probably about 70% of the time across the U.S., is found in advanced stages. So lung cancer is staged 1, 2, 3, 4. 3 and 4 being advanced, and really not curable.
Yeah.
And but what we found in the last 3 years since we started screening for lung cancer, we've totally turned that upside down. So now we're finding it's probably 70%
Stage
of our
one and
lung
stage
cancer,
two.
stage 1 and stage 2,
I know, it's really
which are
powerful.
curable.
Yeah.
It's a curable disease.
Yeah.
And so I think the message, to present is that lung cancer does not have to be a
death
deadly
sentence.
disease, a death sentence.
Yeah.
We
Yeah.
can find it early and it's treatable. And then in addition to being able to find earlier, it kind of dovetails with these landmark changes in lung cancer treatment.
Yeah.
So we have a whole new world of biologic therapies where people are treated with targeted
Yeah.
biologics. And so where once people felt like a diagnosis of lung cancer was maybe, a course of fairly
Radiation, chemo,
difficult,
yeah.
chemotherapy and radiation. Now, sometimes there's the possibility of just taking a pill, and having relatively well-tolerated, chemotherapies that really deliver meaningful
Yeah.
results.
It's amazing, and what you said I think is really truly important to reemphasize, which is, if smoking does cause it, smoking is an addiction, right? So the reality is we have to detach the shame associated with that from the fact that people can get sick, and you just need to start to do something about that
Right.
to help. So I think it's important. It's sort of like behavioral health and mental health. It's de-shaming so many of these things that keep us from getting the help we need.
Absolutely. And people don't have to quit smoking to get screened.
Yeah. Yep.
So, of course, we're always going to be
Advocate.
advocating towards it, yeah.
Yeah,
But no,
of
people
course.
can still get screened even
Of
if they're
course.
still on that process of becoming a non-smoker.
Yeah. Really helpful information. I want to pause for a moment and just check with Phil. Nothing came in. Dr. Lerner, thank you so much for being with me today. I think it's a really important topic.
Yeah.
As I've become more educated, I'm so impressed with what we're doing. I'm really, really impressed with the lung cancer screening program. And I think there's lots of opportunity for us to get the word out about what we're doing. Anything else you want to share that I didn't ask my question that I always ask. How did you choose to become a pulmonologist?
Oh, gosh. I love, as a pulmonologist, you do both pulmonary and critical care.
Yeah.
So I love the pace of critical care, and I love kind of the camaraderie of
Yeah.
ICU. But then I love that I'm able to have two different hats.
Mm-hmm.
I can have the continuity of a relationship with my patients in the outpatient world, and then take some time and go into the ICU.
And that's amazing.
Yeah.
I would not have known that would have been actually how you would have split the work. So
Yeah.
I always learn something when I ask that question. So Dr. Lerner, thank you very much. So again, I was joined by Dr. Laurie Lerner, who is a pulmonologist at Rochester Regional Health, and we've had a good discussion about lung cancer because it is Lung Cancer Awareness Month. If you have any additional questions, please feel free to leave them for us, and we'll get back to you with answers. And thank you so much for being here.
Thanks for having me.
Have a great day.